HealthLink is a health system integrator. We deliver services to 10,000 medical organisations across New Zealand, Australia and Canada. I'm here today to talk to you about CareInsight, a service that we've developed in conjunction with our development partner, Dr. Info. Query-based exchange is the logical way to share information in an emergency care setting. It does not require large patient databases or electronic record systems, which are very expensive and difficult to maintain and keep up to date. CareInsight has now been used for more than a year in several regions across New Zealand, and its usage is growing very quickly, in fact doubling every 3 months or so, and used literally thousands of times a month. CareInsight is a HealthLink service. It's been developed in conjunction with our development partner, Dr. Info. I'd like Sam Jacobs, founder and CEO of Dr. Info, to tell us a little bit more about CareInsight and about how it works.
At Dr. Info, we've developed expertise in connecting to multiple data sources and be able to retrieve and present information where and when it's needed. We've adapted this infrastructure from multiple products, and one of the exciting products we'll talk about is CareInsight, where we're able to present information for a patient from multiple data sources simultaneously within seconds, being practice management systems, pharmacies and other health providers. We've partnered with HealthLink to implement CareInsight in ED departments and after-hours medical care. HealthLink provides the customer support aspects of CareInsight, and most importantly, HealthLink also provides the security behind CareInsight information exchanges. So the way CareInsight UrgentCare works is, for example, a patient arrives at an emergency department or after-hours medical center requiring urgent care. And in many cases, the patient is either incoherent or unable to provide accurate, full information on their medical history and medication. Now, this leaves the doctor with insufficient information to make the most appropriate care management decision for that patient. However, the doctor can obtain the consent of the patient or their next of kin to use CareInsight network and access key medical information from GP practices and pharmacies which the patient has visited. Using patient identifiers and the doctor's CareInsight authorization, the doctor can use the CareInsight system to look up the patient's medical summary. Within seconds, at any time of the day or night, CareInsight is able to directly access the medical records where they reside. For example, any medical center the patient has been seen at, or even any pharmacy the patient has had medication dispensed from. Now, this enables the doctor to make a more informed medical decision, and in many cases, this information has changed the management and care pathways the doctor has given the patient. Now, anytime the patient data has been accessed, the GP is sent a notification via HealthLink secure messaging. In many cases, this notification also includes medical notes from urgent care providers. So the most important aspect of CareInsight is being able to retrieve and summarize information, then present it when and where it's needed instantly. Let's hear from some of the users that benefited from CareInsight up till now.
We looked at the different options on the market, and clearly CareInsight was the one that was preferred by the local clinicians as the safest option for sharing data. Where it's worked most effectively is in the after-hours medical and injury centre we have locally. And at the moment, all of the GPs provide the after-hours workforce in that centre, and they're able to look at their colleagues' data for individual patients back in their practices. And the security they get is the awareness that when anyone looks at their data, they are told almost instantaneously who it was and when it was that they were looking at that data. That's given them a lot of confidence to use this product.
I can think of a case where I had a gentleman who was somewhat reluctant to visit doctors, but has a multiple list of chronic conditions, including insulin-dependent diabetes, ankylosing spondylitis, migraines, and he was on a host of medications of which he really wasn't very clear or forthcoming about what they were. It was really critical to my care that I had some understanding of what he was already on. And I accessed CareInsight, which I found very straightforward and easy to do. He was very happy for me to do that, and felt that it was a very good system because he couldn't always remember everything that he was on. He was on so many different medications. It came up straight away, list of everything he was on, confirmed his chronic conditions, and gave me a list of his intolerances and allergies as well. which made a significant difference to the care that I was then able to provide for him. It only takes a moment to get on, and it actually does help to speed the consultation up because you're not trying to work out what it is that the patient's on. It's all there and very clear.
We're able to access a list of current medications and prescriptions and a list of recent and past medical problems on many patients presenting to the emergency department. And this allows us to have more information to make the right decisions about patient management. As an example, we had a patient who presented with a polypharmacy overdose after hours in the emergency department, and the patient was too sedated to give us any information at all. We had no record from previous hospital visits as to what medication that patient was on, and we weren't able to contact their GP or have any knowledge about what their normal pharmacy was. Using CareInsight, we're able to quickly obtain a list of current medications and work out the likely drug that was involved in the overdose. So it made a significant difference to the management of that patient, and there have been numerous other examples as well.
The information that it gives you often, certainly at that time of the day, is you can't obtain it anywhere else, and I would say in a few cases it has kind of revolutionised as a patient's care, and I think it really has helped my practice. I strongly recommend it. I think it's a brilliant system.